Okay, so in this video, I'm gonna share the most expensive lesson I ever learned in wound care. And so when I managed a clinic, I remember that all throughout the years, the difficulty that we had was managing like cash flow. And so we had over time started to discover that a bunch of visits we were doing, we were losing money on. And so we had providers going out and essentially if they were not grafting a patient, then you could flip a coin as to whether or not we were even gonna make any money. And so this was before I understood any of the coding in wound care, before I understood any of the real like importance of providers following a protocol. Not that I was on the clinical team, but just like the lack of systems we had, I didn't really understand the impact that they made. I just said, hey, providers, we've got good providers, they're experts, they go out, they go make a decision. That's what was medically necessary. And so that's what we can bill for. And so I remember that at one point, we had brought in a consultant who had worked with much larger wound care companies than ours. And I brought her in because I was like, hey, we need help on the management side because we are trying to make our business more profitable and more organized. And we are struggling majorly. And there's many things that I don't know that I need to learn. And so the most impactful system that she helped us to develop, and it was something that I'd had in mind before, but I wasn't sure about the legalities of it, and so I kind of left it alone, but brought it back into play after discussing things with her, is an RVU system of compensation. And so essentially the difference is we had started off with a flat rate payment. So we would just pay providers a flat rate for the visit, and then we pay the mileage and they'd go do their thing. Well, we transitioned them to an RVU model, which essentially meant we're going to pay you based on what you do, like the amount of work you actually put in. We're going to measure that in units. We're going to look at what's allowed legally, what's appropriate, and we're going to pay you based on what you're actually doing in the visit. And what you're actually doing in the visit is, that's what we billed for. So if your documentation said X, then we're going to bill for X, and you'll get paid for X. And so if you did X and Y, but you didn't document X and Y, we're only gonna bill for X. So that's also gonna become your problem. And it's gonna guarantee that we make money because setting it up this way, we're no longer gonna be paying you more than we're getting paid guaranteed, or more so guaranteed. And so I remember like one of the hot topics at the time was like, man, our utilization is super low. Like after talking to our medical director and different physicians, like our debridement was like 20, 30% maybe. And I remember talking to many different physicians and I'm like, your debridement is 80%. Why do we debride so little? Like, I don't get it. We debride so little. We haven't grafted in over 6 months. Like, what is going on that we're not, like, what are we doing in these visits? And I remember thinking this, saying this. We talked about it in meetings to some extent, respectfully, but nothing changed. And we released the RVU model that summer. I remember we released it like in May-ish. Yeah, I think it was May. And so it came out in June where everybody knew, okay, starting in June, if you do not document a service that you did, like whatever you document is you're gonna get paid on, and this is the fee schedule. Like this is the RVU model. So if you go and do an E&M code, you're not going to make $120. You're gonna make like half that because we don't get paid $120 when you just do an E&M code. And so like just these concepts, I was like locked into sharing with our providers, like you should make more money, but you actually have to do stuff. If you're doing wound care visits where you're not having to debride, like what are you doing? Because we don't make money. And by definition, that seems like a patient that doesn't need our services. And we've been, again, trying to offload as many of those patients as possible. They were not getting discharged as much as we wanted. All this being said, we had a lot of holes financially in our company that I could not solve for several years. It was extremely frustrating. When I tell you, in all of my career, I have never seen a shift that happened like it happened in June. Every service line, we had a utilization target or benchmark based on data that we had looked at with other providers. We knew, okay, most providers are debriding more than 60, 70%. Why are we at 20%? Most providers are using imaging this much. Most providers are grafting this much. Everything, we're at like 2 standard deviations lower than everyone. When I tell you that the next payroll cycle, like the first 2 weeks into June, when providers turned in their pay sheet for services that they had billed, every service line, we hit our benchmark and then some. Like our utilization problems went away literally overnight. We had spent additional money to bring in experts who were like, hey, maybe our providers don't understand how to debride. Maybe they're afraid to say that. The medical director came in and she was like, I think your team, we need to work on some things. We just got a new medical director. We had compensated her to do additional work with our providers, like all these other things we had spent money on. And none of them seemed to really be changing anything. But the moment we made it so that if you are going out and doing visits and not really doing something, we don't get paid much, so you're not going to get paid much, everything changed. And so the lesson I learned in that was that if you are running a wound care clinic or a provider practice in general, especially in the mobile space, you have to have your providers aligned and legally incentivized for the best interests of your patients and of your business. You have to do that. All the new service lines you buy, all the products that you buy, all the new service lines you try to implement, all the system, none of it matters. If your providers don't care, if they feel like it's not going to change their financial outcomes, no matter how much work they put in or don't, you are always going to underperform as a clinic. And that was the most expensive lesson I've learned in wound care. And it shocks me still this day that I did not learn that sooner. That if my providers are not incentivized for the best interests of my patients' healing and our business, both outcomes are going to suffer. And so that was a huge impactful lesson for me on the management side of learning that and knowing that that was the most important piece to make anything work in our companies. Our providers had to be on board and had to be incentivized appropriately. And so hope that's helpful, especially if you're managing multiple providers. I would just encourage, get them on board and make sure there's a system in place that rewards them with doing what's in the best interest of your patients first and also your business. Hope that was helpful.